For the spring on surgical charges. This is Kenny Walls, and we're very thankful for you. As we get started, we'll do some brief introductions and then talk a little bit about the focus of today. The what of this presentation, the why of why we do these forums is pretty simple. This is the second forum. If you missed the first one on the editing engine within ExcelerSmart, we'd love to share that with you. It was very well attended and very important. This one is an augmentation of that for surgical charges and capturing surgical charges. These are all led by our users. We have panelists that contribute, and then our staff comes in and talks about best practices within other groups as well. It's a big talking point around our office that it really all starts with a discussion. And we're thankful for you and your attendance today to do that. The focus is better outcomes through collective experience and also how we can best serve you and better serve you as we go through our day. And then, of course, it's always helpful and enjoyable to build a network of friends and colleagues. And we have some very talented and interesting clients. As you know, I love learning stories about our clients. We have, just as a kind of a light note, a couple of quick stories about people that are on this call. We have a wonderful lady on this call that owns and enjoys a 220-pound Labrador. We have another beautiful lady on this call who has the New Testament, believe it or not, etched on a ruby on her watch. So some very, very interesting people, and we learn from that. One thing I learned last week, too, as we kind of go through this, and not a client story, but a quick, interesting learning story. I had an opportunity to spend some time with the Irwin brothers last week, which is a director, two brothers that are directors and producers of films, and they had a film that debuted Friday night called I Can Only Imagine, about the band Mercy Me and the story behind that. That's not important. What I took away from my time with them was this. It's a $7 million budget. They knew that their core competency, that their audience, their sweet spot would provide a break even. And they were anticipating about 3 weekends or 17 days to be able to not only produce the $7 million that it took to make the movie, but a nice profit for the investment. What they didn't expect, unless people got out of their comfort zone, was the reality of a $17 million opening weekend. So the expectation of $7 million and the actual result of a $17 million opening weekend came down to this. We talked to them Monday, and they said people got out of their comfort zone. And when they got out of their comfort zone and they talked about the movie and they invited a friend to the movie, it drove a tremendous return on that $7 million investment. And when I was thinking about that and hearing that, I was thinking about this week in a very similar story about what we're doing, the core competencies of ExcelerCapture and ExcelerSmart, being able to get the general clinical encounters done. But what about stepping out of your comfort zone and actually handling the high dollar, high visibility encounters with surgical charges, and being able to draw upon the breadth and the talent of the people in your office to manage those. So that's kind of the theme of today, is the energy behind capturing surgical charges. We're going to look at an opportunity that Janice Hopp, who's on the line, will be our panelist today with Rocky Mountain Orthopedic, found in her practice. And she will absolutely talk to you about the hurdles and the opportunities that they saw and recognized and are working through within Rocky Mountain Orthopedic. We'll talk about a different type of situation with Rothman Institute in Philadelphia, and then we'll bring up several different examples of clients and how they're capturing it through Capture as well, Palmetto Retina and Orthopedic Institute. then we'll wrap up with Q&A. But when starting this, I'd like to introduce Janice. She has been a wonderful contributor for this project. Janice is in charge of IT and revenue cycle reporting within Rocky Mountain. Also, as Janice is about to come through, I'd like there will be a question that fires on your screen. And if you'll take the time to answer that question right now, that would be great. So basically, we're trying to get a framework for how we're capturing those surgical charges today, whether you're doing that, you're reviewing the op note or the face sheet, whatever that might be. If it's an index card or a napkin from the surgeon, whatever the case may be, and entering those charges directly in the practice management system, whether you're doing that through capture today in some form or fashion, whether you're doing that through Excel Mobile today in some form or fashion, or if you have another method in which you use. Janice?
Yes, good morning.
One of the things, too, that give you some backdrop on the practice itself, there's 25 providers, total providers within Rocky Mountain Ortho. In her workflow, the providers mark the encounters and the coders will assemble batches and process within Excel Smart. Roughly about 80% of the total population are involved with surgery. From a volume standpoint, and this was very telling to us, roughly 400 to 450 encounters per month with an average surgical charge of a little less than $2,000 per encounter. The clinical volume obviously is much higher with a much lower average encounter charge. So what that really, when you do the math, that ends up saying that surgical charges on volume perspective, only 17%, but make up nearly 2/3 of the entire revenue from the practice. This is very common amongst our clients, and it's telling from the standpoint of the additional value add and the additional return on investment if you're able to maximize that coding opportunity through Excel Smart. So really getting it ahead of Smart in the process, regardless of how you capture that in Capture or in mobile, is really the end goal. And then the platform that Janice has, and I'll turn it over to her, she runs SRS from the EHR perspective and Centricity on the practice management side. So Janice, you've been with us since 2015. You want to talk a little bit about the reason you came on board and kind of go through that?
Yes,
logic?
I will. Yes, thank you. Good morning, everybody. We went live on White Plume in July of 2015, and our ultimate goal was to implement ICD-10 with the least amount of impact to our revenue cycle. Before we went on White Plume, our providers were still marking paper super bills. They would mark the actual CPT code, and then they would handwrite the diagnosis code. We didn't even have diagnosis codes on our super bills at that time. And then the process was our coders would take those super bills and input the charge data into the practice management system and add modifiers and diagnosis codes after reviewing each note. All three of our coders have extensive knowledge that's been earned with years of experience. We do have somebody that's a 36-year veteran of the practice. We anticipated some angst with the change that required our coders to trust the data providers were putting on the encounters. The challenge for them was to only look at the dictation when a validation rule hit, and they needed additional information to resolve the edit. We overcame the challenge, but that did require some time to accomplish. We continue to struggle with our lag time for both clinical billings and surgical billings. So we kind of started to review our processes to see if there was a way that we could improve that lag time. And our practice is a little bit different. All of our coders basically do code both surgical and clinical. And the process for them coding the surgeries were to basically wait for the op note to come in, review the op note, and then input those charges directly into our practice management system. So to help with that lag time, we started to think, well, there's certain surgeries that don't require a lot of coder review to get them out the door, and those being total joints, which typically are one CPT code and one diagnosis code. And we approached some of our total joint doctors. We started with 2, and we ended up with a new doctor that came onto the practice that's a total joint, that he just went straight into doing it this way, and asked if they would be willing to input their charges into Excel Capture. Our goal was to have these surgery charges to follow the same outline as our clinical. That way that they are going through Excel Smart, they are hitting edit, and actually to help increase our lag time. The charges are put into Capture by the provider, they're pulled into Smart, validated, and then they're reviewed only if there is an issue. From the start, we wanted there to be the least amount of work for the coder. I worked with our forms designer, Allison, and to automate the process as much as possible, we created a total joint tab for each provider on our current encounter. And since the physician typically uses the same PA for their CIS, we were able to hard code that PA in on the form. So all the doctor has to do is select the CPT code. The corresponding top diagnosis codes for each of those body parts are directly below that CPT code. And of course, they can still pull in historical diagnosis codes as needed. And then once they're actually pulled into Smart, the coding that Allison was able to do on our form, it actually pulls it in and it charges out the assist code on a separate line item. And then once we import that into our practice management system, it actually creates a new encounter for the assist. The whole idea was to make it as seamless as possible and for our coders not to have to touch it to increase that lag time. Now that we've done this, we're starting to go through the whole process of what's our next step? Total joints are pretty easy. So now we're examining how we can actually increase, especially with the upgraded version 5.1.120, the capability of displaying global periods. Now we want everything to go through there. So then we started that process to evaluate it, to find out how we can put all of our surgery charges in.
Yep. And Janice, this is Stuart. One thing I think is good for the rest of the people listening to know is that explosion logic, where the provider only has to click one line and his most common assistant surgeon is exploded to 2 lines in Excel Smart, that second line doesn't have its own appointment. And so with your practice management system, between White Plume and Centricity, we're able to split that into an encounter that didn't start as an appointment. And your users are not having to clone that initial encounter and add all that information that they once were doing. So every practice management system is slightly different how they handle that. Some we perform the splitting, some they do. There might be 1 or 2 still out there that don't allow a non-appointment based. But that would be something you would want to explore as you pursue the solution that works best for your practice. I think Allison wants to look at the form and you guys kind of point out some of the magic things you've done there.
Actually, let me do this. Put that background.
Hey guys, this is Allison. As Janice mentioned, I'm her forms rep who assisted her with developing her surgical form. With this particular layout, we had 3 tabs. We had a tab for Dr. Nakano, Dr. Luker, and Dr. Stryker. And each of these physicians did slightly different procedures based on their specialties. So with Dr. Nakano, what we did is we set up 2 sides of this form. Let me expand it a little bit. So for example, he had hips and knees were his primary surgical procedures that he did in a total joint capacity. On the left side of the screen, anything that's in the blue or the green, these procedures were hard-coded with magic to add the assistant surgeon provider and the assistant surgeon modifiers. And we discovered, as Janice and I were talking, that the majority of the procedures that Dr. Nakano did for hips and knees were performed with an assistant surgeon. So on the left side of the screen, we chose that as our default. But if there was ever an instance where they did not use an assistant surgeon, Then, rather than marking under the blue, they would go to the red boxes that were labeled without assistant surgeon, so that that extra modifier and that extra provider programming would not trigger once the encounter was assembled into AccelaSmart. So, also on this tab, you can see that they have their main procedures that they perform. They have their procedure that is hard-coded with the modifier, but then they also have their most commonly used diagnoses that go with those particular procedures. The idea here is that this one tab could be a one-stop for Dr. Nakano. He wouldn't have to flip to a second tab in order to find the diagnosis or enter other information. So Dr. Stryker is set up in a very similar format. They have their most common procedures on the left-hand side that are also hard-coded with their assistant surgeon. The one thing I did not mention is if they did not use, say for example, Dr. Stryker did not use Scott Stephen as his assistant surgeon, but there was somebody else filling in for Stephen that day, then there is a protocol in place for the capture users to mark the encounter with this extra note that says other assistant surgeon, so that it would stop the AccelaSmart biller in as they are validating, so that they can go in there, look at the note on the chart and see who the appropriate surgeon is, assistant surgeon is, and they can mark that and bill that correctly. One other thing that is helpful in the surgical environment is having global periods and patient last seen dates displayed in the header, which Rocky Mountain Ortho has added. Now, under the global period dates here at the top, you'll see that you've got 99202, 99201, and the line for tab. Just ignore that data. This is a demo environment, and the demo environment randomly grabs procedures to fill in the blanks. So in a real live capture environment, what's going to be displayed in these boxes are going to be procedures like 27130, actual procedures that have global periods in them. So just indulge us a little bit for this example. But then you also have a box over here for the date that the patient was last seen. So from a surgical standpoint, your billers may really want to know, okay, my global period for this particular patient, it's still active, so that means I have to add a particular modifier for that procedure once I'm going through and validating everything in order to get paid correctly. So that's where that would come into play for them.
Hey, Allison, so I think one thing too to think about is while the global period, unless you stack surgeries close to one another, the coder isn't necessarily thinking about that, but the big impetus for many people is recognizing that unless the surgeries go through White Plume, the clinical coder, or who's trying to determine is this visit in the global period, is a real big important part too. So yes, the hospital coder could see this, but unless the hospital coder is doing their surgery, the clinic coder is handicapped without seeing that global information.
Correct. And that kind of helps also bring up another point. When you're thinking about your forms design, one thing you have to consider is who is going to be marking the capture form. In an office or clinic setting, normally it's going to be the provider or maybe an assistant who goes in and marks the charge. When you're dealing with surgical claims, though, that tends to reverse. You tend to have more billers that are marking the capture forms as opposed to the physician. So how you design your encounter form can be tailored based on the primary consumer. What I mean by that is your physician is not going to necessarily care about seeing, global period modifiers on the capture form. They're going to want to know right, they're going to want to know left, and that's about all they're going to care about a modifier. But a biller is going to care about different things, and they might want to mark those items on the capture end before they get to SMART. So this particular tab is then designed with a doctor in mind. It's clean, it's streamlined, it's got all the essentials of what they need and no extraneous stuff. From a biller standpoint, there's a lot of extra details that they would care about. And we will look at an example in a few minutes of one of those tickets that looks like that. Stuart, at this point, were we going to look at the AccelaSmart side, or is that for later?
You have that next, right?
All right.
So the next slide, Kenny will get us to because you added some magic so that you didn't have to have two lines marked for the assistant surgeon charge on the form, but it still is accomplished.
Right. Okay, guys. So On the capture side, if you remember how we talked about, there was a column for marking assistant surgeon, and there's a column for marking without assistant surgeon. And the reason why we had to set it up that way was for different billing needs. So in an assistant surgeon environment, what happens is that you have to have a second encounter form created for the assistant surgeon billing. So you've got one encounter for the main billing provider, and then you've got one for the assistant surgeon. Well, rather than trying to create two encounters in Excel Capture, we have a way of marking the ticket so that in ExcellaSmart, what comes in are these two separate line items. And if you'll notice on the very first line item is provider 012. This would be for the billing provider, and they've got their regular left modifier. On the second line item, you have the 27137AS indicating the assistant surgeon, and a different provider also listed under that column, 037. And what happens is in the outbound message, once this encounter is sent out of ExcellaSmart and hits the practice management system, for those practice management systems that will allow us to configure it this way, what they'll do is they'll take when they see those two different providers, they will actually split the ticket and keep all of one provider on one ticket and all of the assistants on a second. So that what used to be an extra step for Rocky Mountain Ortho, where they had to physically clone a second ticket, is now automated for them. Not only that, we have an extra table built that assigns the appropriate providers based on what's being marked, which is another major time saver for Rocky Mountain Ortho. Now, on the screen, you may notice a few differences from your ExcellaSmart screen. This screen reflects a 5.1.12 environment. That environment, that particular version, if you have not already upgraded, allows for HCC coding calculations. It allows for global period information and date last seen. So we've got a few extra boxes up here. We also notice on the diagnosis columns down on the procedure lines that it doesn't just end at 4. Now you've got 5, 6, 7, 8, 9, 10. Based on your practice management system configurations, you now can link more than 4 diagnoses to an individual procedure line. So there are a lot of new features and functions that are available with our latest version of ExcellaCapture and ExcellaSmart. If you have not upgraded, I strongly encourage you guys to start looking at that today and to get that process in place.
And it's true that we'll talk about a more coder designed form in our examples later, or no?
Yes,
right.
We do have another example of that.
Okay, all right. So that's
well, actually, once you, I think.
Well, so two points I wanted to make. Because hospital coders know they're dealing with a smaller subset of codes, and they are very experienced and memorize a lot of stuff. Some people, when they design the form for them, particularly the diagnosis information, whether it's commingled on the surgery tab, so they don't have to toggle between a procedure and diagnosis tab, or if it's its own diagnosis tab, they may be in strict code order because coders don't need anatomical breakdowns or alphabetical descriptions to get where they want to go. So if the form is going to be consumed by them, tailor it to them. And if you have a coder who says, oh, I've been hand keying, I'm a 10-key expert from way back in the day, and clicking and a mouse takes me so much longer, but you still want them to focus on getting the surgery charges in White Plume so that you can benefit from that global data for the clinic visits. The rank and link tab, remember, you can just go to the diagnosis spot and click add, type the diagnosis, go to the procedure, type the procedure code. So for somebody who goes, I know those things off the back of my eyelids, I can type them in my sleep, just realize you're going to do what you have to do to facilitate the most expedient collection along with the most accurate method.
Okay, so guys, I have one other sample of an encounter form here. I'll just go ahead and pull it on over. This particular encounter form does not have global periods, but it does have surgical charges on the form. So that's okay. You can still enter surgical charges whether you have global periods or the higher version, whatever. You can do that on any version of White Plume that you currently have. But you'll notice here how their modifier list is a little bit more expansive. You have your right, left, and your 50, but then you also have your 51, 58, 78, and 79. Now, this client has been using these modifiers that are known to have global period factors involved in them, like the 58, the 78, and the 79. But you can notice how they don't have a global period box at the top of their form. So for this client, they managed to make it work, but you can see the advantage of adding a global period to your header, because at that point it gives them a little bit of an extra clue and just guidance and hand-holding to know when that is most appropriate.
And that might matter too. There's some clients who still have a physical sheet of paper that follows the patient because they want to have a name in the back of the door, or something that's a visual clue for the doctor. So if that sheet that's printed out of your EHR or your practice management system has in big bold font right at the top, in global period expires during this date, they may not have had the same impetus and urgency to get it on our form. So, but still they're doing their surgeries, so they've got it so it can be edited, right? So it's not just the fact and data collection, but for data integrity, when it goes into Excel Smart, you want to make sure that it was done.
And this is Catherine Lowry, another forms rep at White Plume speaking. This is just another example of a orthopedic surgery form that we've created. And as you can see, it doesn't, it's pretty simplistic in view, but it does have the CPT codes and the diagnosis codes broken down by the region of the body, which allows the users to efficiently get those charges into ExcellaCapture. Going to make it a little larger. No, they can zoom on their end.
All right, so those are three good examples and different examples of capture-based forms and being able to select and route the appropriate information into SMART. So we're actually going to switch gears a little bit and look through a slightly different lens right now about Rothman Orthopedic. And before we do that, though, I'd like to pose another poll question. So approximately how many surgeries does your average provider perform in a given month? So less than 10, 10 to 25, 25 to 45, and 45 to 80. What was the feedback from the first question while they're doing that? You know?
That's everybody. I can't take right now.
Okay.
Mm-hmm.
And then as we move forward with this, I'd like to introduce Sally Miller from White Plume. She is a CAE for Rothman Institute. She's on the line as well, and Rothman has given her permission to work in their stead. They actually are in a conversion this week. Sally will tell you a little bit more about that, converting to a different PM system. So Sally's going to talk a little bit about Rothman and their environment dynamic.
Thanks, Kenny. Good morning or good afternoon, everyone. I guess depending upon where you are. I am going to speak on behalf of Rothman. I wish that they could be here because I am certain they would do a better job, but I'm going to do my best. As Kenny mentioned, they are in the midst of a conversion from Allscripts Vision to Allscripts PM. And as we like to say in the South, bless their hearts. If you've been through PM, I think you can relate, and maybe we should offer a moment of silence for Rothman this week. They're in training. But they do have a very unique process that they've implemented recently for their surgical charge capture. And so I think we felt remiss if we didn't bring it up and introduce it. Not to say that it's the right workflow or fit for everyone, but if nothing else, I think it's a great example of really thinking outside the box and thinking, as Kenny said, through a different lens of how might this work for our practice. They are a large practice, 234-ish providers and growing, based in Philadelphia, but practices really stretching pretty far up in that northeastern corridor. When they started with White Plume back in 2013, they did, like most of you probably did, and started with the simplest process, and they started with their office-based charges, got those rolling on code scan done, migrated to Excella Capture, and really got that process clicking. And then they recognized that their surgical process was kind of a mess. They had all different methods happening. They had a Excel worksheet where physicians entered their surgical charges there, and it got back to the coding department. They had napkins and scraps of paper and all kinds of things with which the physicians were using to collect their surgery charges, and that also led to an issue with timeliness. So they were all across the board with how quickly or how not quickly they were receiving those charges. So they recognized that was their problem, and they really wanted to kind of tackle how can we streamline this with the physician in mind, and thinking how can we ultimately likely need to get this data and information from the physician, but how can we do that in a way that keeps their productivity and keeps the timeliness in line. So their goal is to improve physician efficiency in capturing the surgical charges. They also wanted to find a way that they could capture this through White Plume with the knowledge that they have multiple points of entry. So there are multiple owned ASCs, not owned ASCs, multiple hospitals that their physicians are going to. So they had to keep that access of White Plume in mind, and then wanted to also improve the timeliness. So that was the things they were thinking through as they came up with this process. So I'm going to kind of walk you through their workflow today. The initial step is that the surgery does get scheduled in their practice management system. And when that surgery gets scheduled, it then creates an encounter basically in Excella Mobile. So they have opted to use Excella Mobile as their White Plume point of entry for their surgical charges. Now, keep in mind, for those of you, a good number of you probably on the phone that use Excella Capture, that these two can be used you could insert Excella Capture when I say Excella Mobile. The benefit to Excella Mobile for Rothman is that multiple point of entry problem. So, Excella Mobile is a web-based platform, so it can be accessed really from anywhere. And that may be from a PC at the surgery center, that may be from the physician's phone as they're walking out of the hospital. So that was important to them. Their physicians were asking for a web-based mobile platform, so that's how they got to Excella Mobile. So that surgery gets scheduled, it creates the instance of the encounter for the surgical charge in Excella Mobile. And from there, this is where their process veers from the norm. They actually start the encounter with their pre-certification department. So there's a pre-certification rep that takes that surgery and goes through the pre-cert process with the insurance company. And as a part of that pre-cert process, that pre-cert rep then opens up Excella Mobile, goes to that encounter that was created, and enters the diagnosis and the CPT code that was pre-certified for that patient, for that surgery that's to take place in the future. So they mark those codes, they leave that mobile encounter in progress. So just like you can leave an Excella Capture form in progress, they leave that Excella Mobile encounter in process. So then we fast forward to the date of the surgery. The physician performs the surgery. The physician then is able to go into Excella Mobile, and instead of bringing up a clean encounter, the physician opens up that mobile encounter for the surgery, and they find what the pre-cert rep has already pre-marked for them. And then a couple of things could happen. The physician either indicates, yep, that's exactly what I did. That's the diagnosis, that's the procedure, everything happened as expected, save and complete that encounter, and they're finished. So it could be as quick as pull it up, take a look, yep, that's right, save and close. The physician didn't even have to mark anything differently. It could also happen that the surgery did not go as expected, and they did something different. They went from a total hip or a partial hip to a total hip replacement. So they have to change or alter that CPT code, and they're able to do that fairly easily within Excella Mobile at that point. So the goal being that in a best case scenario that I believe that they find happens most of the time, everything happens as expected, and they're able to review, approve, save and complete, and they're moving on. Once they've completed, either they've saved and completed or they've edited and completed, at that point, that encounter then gets picked up by their Excella Smart team and flows through the through the normal process of review and editing and then completing to their PM system. So if we take a look at the next screen, that's going to show us just a quick screenshot of Excello Mobile and what it looks like for them. So this would be the physician's view. So once we kind of make our way through, surgery gets scheduled, encounter gets created in mobile, pre-cert department initially fills out the form, if you will. That's where we are right here. So they've added the diagnosis, they've added the total hip replacement on the right side. You can see that there. The physician would then pull this up from their phone, from the PC in the surgery center or the hospital. And then at that point, they would decide if this is correct, I'm going to use that green button and say save and complete. Or if something changed about the procedure, I could use that red X that you see there to delete that procedure line and then go to add procedure and add the procedure that did occur. And then at that point, I would save and complete, and I'm about to my appointment list and moving on to the next thing. So that is Rothman Institute's unique, but I think very efficient process for how they handle their surgical piece. And I think they've been pleasantly surprised on both ends. I think there was maybe a little bit of concern out of the gate of how the pre-cert department would respond, and are we putting too much on their plate? And so far, they traded out. They already had the responsibility of the CPT code and the ICD-10 code, and so it's just a different point of entry of where they're putting that. And I think they've gained in the timeliness and the efficiency for the physician that so far, they're still in the process of rolling this out, but so far it's been a good move for them overall.
And Sally, I want to go back on 1.2. This is not mutually exclusive with Capture. So they could in an environment, and these are two totally different, what you saw with Rocky Mountain Ortho and what you've seen with Rothman are two totally different perspectives and processes to get to the same point, but they're not mutually exclusive. You could have a mixed environment as well. Correct.
And the pre-cert department could do the same thing that Rothman is doing in mobile. They could do the same thing in Capture. Yes, and they could have half of it happening in Capture and half of it happening in mobile, and would work just the same.
Okay, well, thank you, Sally, from that. And Janice, can you unmute yourself? And let me ask you a quick question too, as we're going through, because you took a phased approach to your process, correct?
Correct.
So a small bite of the apple, so to speak, in doing the total joints. And that gave you the comfort zone and the time to educate the coding staff and to build champions within that coding staff, and then not only champions there, but champions at the provider level before you took the next step. So I didn't want to miss that point, because sometimes we have the thought that we have to have it complete and perfect day one, and this is an iterative process, but we're going to drive incremental value one step at a time and moving through. So the next bite of the apple will be a little bit larger, but you've got the confidence and the comfort from your staff, and I don't want to put words in your mouth, correct me if I'm wrong, that it's a valuable process. Is that correct?
That is correct. And really, we do need the input of the coders, because if they're going to be the ones putting the surgery charges into Capture, their thought process and the way that they would put those charges in are going to be completely different from the provider's thought process, or even my thought process, because I'm not a certified coder. I can look at it and say, well, to me, it should work this way, this way, this way. And we've done that before with certain things on our encounters. But once we put into a real life situation, we found that we've had to make some modifications to the encounter form. That's why we brought a coder on to help us. And our next process would be, okay, so what's our next step? How can we create a whole new surgery form that will allow us to input all of our surgery charges directly into Capture, and then pull them into SMART, and then onto our practice management system.
So going back to that process, if you can think about the timeliness and time frame of that, from the time that you wanted to input surgical charges to the time you got total joints done, how long was that process? And then I'll ask the same question to Allison about the length of time for that.
how much time it took to develop? Ooh, that's a little hard to say. There were a lot of phases. There were lots of Q&As that went back and forth because of the complexity of what we were doing. From the standpoint of the forms design, it took at least a few hours for each tab. And then there was, I would guess, at least a couple of hours on Janice's end to do setup in order to make things work on her end. So there was a collaboration here.
And Janice, from the time you had the idea to the time you doctors implemented that was how long?
I would probably guess we're the 3+ month range, and a lot of it was the process of working with Allison to determine that's the best way that we can have this happen with our encounter form, and making some modifications. And then actually we went live with 2 doctors, with Dr. Nakano and Dr. Luker initially. And then of course, when we brought on our 3rd total joint doctor, he just jumped right in. So we'd already started that. So I would probably say it did take us a while, and 3 months. And a lot of that was dependent upon my time frame and my availability to commit to this.
Right.
I think we see that everywhere. It's crazy how everybody wants to devote time to that 40-hour week job that they're already pressed to get everything done. And when you tackle a new project, and then particularly when you're collaborating with others within your practice and scheduling that and coordinating that and getting their input, that factors into that timeline. So as Allison pointed out, the rough time that you're spending on any of that might be measured in hours, but the calendar time, a page or 2 might fall off the calendar just while you're coordinating and fine-tuning that process throughout everybody that it impacts.
Okay, we're getting close to the end, but we do have a couple of other polling questions we'd like to understand and offer you. So if you were to begin to use Excel Capture and or Excel Mobile, because they're not mutually exclusive, to capture the surgical charges, who would be the primary contributor of those? And again, back to the point of that impacts design, and can be from a workflow perspective as well. There's not a wrong or a right answer. Just curious as to, in your environment, who do you think would be the main contributor, whether it be the surgeon himself, a PA, an MA, a medical secretary, a scribe, a certified coder, or other. And then one more question from, as you're answering that. The biggest concern that you have now about your current surgical charge entry process. So if you were to be able to say my top 3 concerns, you can pick 3 from this list. The biggest concern, you're fearful of missing charges. And this could be, I'm fearful of missing an entire surgery, a complete surgery, or I'm fearful of missing a procedure within an individual surgery. Denials that are impacting cash flow, whether they be RVU order, whether they be bundling, modifiers. So what is your concern in terms of capturing surgical charges from a denial perspective? Lag time that delays impacting cash flow. So you need delay that you get either extreme lag times or process delays that impact cash flow. The consistency and the depth of your coding staff, whether they're through attrition or maybe they're absent from work for personal issues, that consistency of getting the appropriate coding, and or another, a risk of audit or a loss of control. We'll hear that often from that. So what are your 3 biggest concerns about your current surgical charge entry process? And we will take the results of all these and provide you with feedback, obviously. And I always think it's very interesting to get your feedback and hear your feedback on this. So we've been monitoring questions throughout the forum, and those questions, those individual questions, the CAE will get back with you from a perspective. Shelley, are there any that are good for the group?
No, we have a couple that were interested in the second encounter of that assistant surgeon, how that splits in their PM. So we'll check on that according to your practice management system. Your client account exec will follow up with you on your specific practice management system and whether that can be done. And then the other questions were specific to the group. Yes.
To each individual group. Okay. All right. Well, thank you. Well, we hope this has been beneficial for you. We are here to help with any questions that you might have, and we will be in touch with you specifically on your exact needs and specifications. As your CAEs visit, this has been a very consistent theme in our visits of how best to capture those surgical charges. So we appreciate your time today. It was very well attended. And we have one.
We will, even when we are finished here today, we will leave the meeting up. So if you continue to have questions, we will stay on for a little while and answer those. So just know that even after we end, we'll be monitoring that questions panel for a few minutes.
And this is Stuart. I would just try to encourage you to think over all the things you've seen today. We've seen 2 different products, Excella Capture and Excella Mobile. We've seen the use of form design features, like that automatic split and modifier that went on. We've seen the use of editing, where people build edits to catch stuff that's wrong. We can even have scripting to manipulate data as it goes back to your practice management system. So there may be features that we have within the products that you'd want to use. So I would just let you kind of ruminate on all the elements that can factor into the solution that works best for your practice.
All right. Well, thank you very much. It's a pleasure to serve you. Y'all are wonderful clients, and it makes it fun getting out of bed every morning to help serve you. Please let us know if we can do anything to do a better job of that. Thank you very much.